Good day, sir. I'm Kimberly Basuel from BSN 3B, and today what I'm going to perform is providing tracheostomy care. Goal: the patient exhibits a tracheostomy tube and site free from drainage, secretion, and skin irritation or breakdown.
Here are the equipments that we need to check for: bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit if available, or 2 sterile 4x4-inch gauze pads, sterile cotton tip applicators, sterile tracheostomy dressing, sterile basin, small sterile brush, small brush, roll of twill tape, tracheostomy ties or tracheostomy holder, scissors, pulse oximeter, stethoscope, 2 pairs of clean gloves, mask, goggles or face shield, hydrogen peroxide, and plain NSS or sterile water.
Now, let's proceed to the implementation. Bring the necessary equipment to the bedside stand or overbed table. Perform hand hygiene and put on PPE if indicated. Then, identify the patient. Good day, ma'am. I'm Kimberly Basuel from NUST, and today I will going to be your student nurse from 7 a.m. to 3 p.m. So, ma'am, I will just check your name, close curtains around the bed and close the door to the room if possible. Determine the need for tracheostomy care. Explain what you are going to do and the reason to the patient, even if the patient does not appear to be alert. Adjust bed to comfortable working position, usually elbow height of the caregiver. Lower side rail closest to you. If the patient is conscious, place him or her on a semi-Fowler's position. If the patient is unconscious, place him or her on a lateral position facing you. To determine if the client needs a tracheostomy care, we need to check if her pad is already soaking wet or if there is any secretions already. So I can see that her pad is already soaking wet and also there is an secretions. Hello po ma'am, good morning po. So ngayon po ay magpo-provide po ako ng tracheostomy care. So, ginagawa po natin ito para po mapanatili natin malinis at maiwasan po ang infection. Move the overbed table close to your work area and raise to waist height. Then next, check for lung sounds. Check ko lang po yung lung sounds niya. Place the towel below the trachea site, covering the neck and chest of the client. Put on face shield or goggles and mask. Suction tracheostomy if necessary. If tracheostomy has just been suctioned, remove soiled site dressing and discard before removal of gloves used to perform suctioning. Prepare the basins and cleaning solution. Mix sterile water or plain NSS and hydrogen peroxide in one basin, or 50-50. Be sure it will fill 0.5 inch of the basin. Then add another plain NSS in another basin that will fill at least half inch. Then, perform gloving. Cleaning the tracheostomy. Remove oxygen source if one is present. Stabilize the outer cannula and faceplate of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand, then press the tabs and release lock. Gently remove inner cannula and place in first basin with plain NSS plus hydrogen peroxide, then let it submerge there for a few minutes.
Hinga po ng malalim, hugutin ko na po.
Simultaneously, gently slide the trachea pad or dressing downward and discard. Then check for some exudate or drainage, skin breakdown, irritation, and inflammation. Clean the inner cannula of the trachea tube using the prepared plain NSS plus hydrogen peroxide, and use brush to remove solidified or sticky mucus. Then rinse using the second basin with plain NSS only. Discard gloves and put on another gloves if necessary. Then dry the inner cannula using sterile gauze or pad, and gently reinsert it back to the tracheostomy tube. Be sure it is properly locked. Dip cotton tip applicator or gauze sponge in cup or basin with sterile saline and clean stoma under faceplate. Use each applicator or sponge only once, moving from stoma side outward. Pat skin gently with dry 4x4 gauze sponge. Slide commercially prepared tracheostomy dressing or pre-folded non-cotton filled 4x4 inch under the faceplate. Check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Then, reapply oxygen source if necessary. Remove gloves, then assist the patient to a comfortable position. Raise the bed rail and place the bed to the lowest position. Remove additional PPE if used. Perform hand hygiene, then documentation. Lastly, we assess the patient's respiratory status, including the respiratory rate, effort, oxygen saturation, and lung sounds.
Check ko lang po ulit yung lung sounds nyo.